welcome again to the issues on IKD 106.1 FM, where we have decided that every Thursdays, such as this one, we talk about matters that will benefit the general public. And talking about matters that will benefit the general public, we always talk about matters that concerns our health. Like they say, health is wealth, and that is why we've set aside every Thursdays here on IKD 106.1 FM, to talk about healthy conversations only. And this is courtesy General Hospital Ikorodu. Special thanks to the staff and management of General Hospital Ikorodu, from the medical director down to every other person who always make this happen every Thursdays. Today, again, being Thursday, 21st of August 2025, we will be talking about another very pressing conversation that needs to be talked about. Now, many a times when we hear the word burn injuries, a lot of Nigerians, a lot of us from this part of the world do not take into cognizance the importance of attending to burn injuries. As a matter of fact, sometimes some person sees this as, it's just a passing. It's a very minor injury that requires nothing too serious. That might not be the case, right? So today on the issues, while we talk about health matters, let us look at a proper response and treatment to burn injuries. Now, this conversation cuts across every sector of individuals, be you man, woman, or even our children. It's a conversation you might want to listen to. From General Hospital Ikorodu, we have the Assistant Director Nursing Services. She's well seated with us here in the studio. We'll be taking us through this conversation again, where we will be talking about burn injuries, proper response and treatment. This will be our conversation for today. And you know how we do it. You can feel free to call us anytime while the show is ongoing on 0904 081 1061 or 0904 082 1061. You can call us and ask us questions. You can call us and contribute to the focus for today, talking about burn injuries, proper response and treatment. I'll be your anchor, of course. I am Opeyemi Adebambo, and my guest talking about Assistant Director Nursing Services, General Hospital Ikorodu, Lagos State, Nigeria, Mrs. Adeosun Folashade Bukayo. She's also well seated here in the studio. So we go on this very, very short break, and then when we return from this break, we will get into the conversation proper. Good morning, Lagos. Good morning, Nigeria. Welcome back, and thank you for still staying tuned with us on the issues this morning. Like I told us, we will be having these conversations and looking at every areas as possible when we talk about burn injuries. You can also send us WhatsApp messages to be a part of this conversation on 0904 082 1061. That is 0904 082 1061. To start up this conversation, it is okay for me to say good morning to you, Mrs. Adeosun Folashade. Thank you for joining us.
Good morning.
It's good to have you in the studio
Thanks
this morning.
for having me here.
Thank you very much, ma. That is the voice of the Assistant Director, Nursing Services, General Hospital Ikorodu. Mrs. Adeosun, we have a lot to talk about this morning, and we are honored to have you in the studio here. You are a renowned nurse, and you know your job well. For those that are listening right now, and we say we want to talk about burn injuries, some persons are already thinking in their head, burn injuries. What is burn injuries? So maybe we should start the conversation from there. Mrs. Adeosun, when we say burn injuries, how best can you explain to Nigerians what that means?
Thank you, Okweyemi.
Yes, ma'am.
When we are talking of burn injuries, it's injury that can happen to anybody at any time, anywhere. It can affect any gender, any tribe, anybody whatsoever. It can happen in the office, it can happen at home, it can happen on the road, everywhere. So, and when you are talking of burn injury is the injury that affects the skin. It's the destruction of skin cells and some other structures of the skin, like muscles. We have muscles, can affect the muscles, it can affect the fascia and bones, depending on the depth and the causes. And there are many causes of burn injury.
Thank you very much, Mrs. Adeosun. I think I like how we're starting off this conversation and looking at what you've said. Obviously, my little findings tells us that we have the first, the second, and third degree of all of these burns. We will get to at that point. Now, there are some sayings when it has to do with medical terms that we always like to let people know on the show. Some ideologies now, for instance, I don't know if this is a myth or it's actually a true statement. When we say burn injuries, some people believe that when we hear burn injury, it only means, oh, injury that you sustain when you have a burn, maybe your gas cooker explodes, or injury when there is fire outbreak. How true is that? Burn injuries are injuries from just fire outbreaks.
No, there are many causes of burn injuries. It can be caused by fire. It can be caused by gas explosion. It can be caused by electrical currents. And it can be caused by chemicals like acid, paint thinner, and some other gasoline products. So there are many causes of burns. It's not only by fire that you can get it. It can be from hot water. It can be from hot cooking oil and steams. So,
Mrs. Adeosun, you know, the reason you're here today is because the public would want to know how best these things can be treated when we talk about burn injuries. And I see we're gradually getting there. If you're listening to us from anywhere all over the world, this is The Issues. And today we are talking about burn injuries and the proper response and treatment to this. Mrs. Adeosun, before we talk about the treatment now, let's still also look at some persons that sees burn injuries whenever they occur sometimes as, oh, it's a minor thing, especially from this part of the world. Oh, it will come and it will go by itself. So I want to ask you, ma, how bad can burn injuries be? How dangerous can it be? Is it something that could get so worse, or like they always say, oh, it will go by itself?
burn injury is not injury that we can overlook. It must be properly treated, because if it's not properly treated, minor can become major. We can add to it. That is why we should not overlook it, because like I have earlier on said, that we have many types of burn injury.
Yes.
So that is the reason why, and each of them has their own specific treatment. That is the reason why we must not overlook it. It's not a minor thing that we should just overlook like that.
Okay, thank you for that one. Now, something you said earlier during the introduction to this conversation, you said burn injuries are injuries that it has no age bracket, it has no gender whatsoever. But some persons say a particular age is more prone to burn injuries, which are the children. Can you help us have an understanding of that? Is this to say that the adults don't really experience it? Looking at your wealth of experience, who are those patients you attend to the more when we talk about burn injury?
Thank you.
Yes, ma'am.
It affects children a lot. Because, you know, children are very inquisitive. And the stage they are exploring.
True.
So, when their parents put down hot water somewhere, they will want to know what is inside that bowl. They can go there, they touch it. Even at times in the kitchen, when the parents are cooking, if care is not taken, the parent may not know when they will crawl there to the kitchen, or when they will walk to the kitchen and touch. They can touch the hot pot. At times when they back them, if they don't put their hands inside, unknowingly they may pull what the parents are cooking.
Because they are always curious.
Because they are curious, they want to know more and more of the environment. So that is why they are more prone to it.
Thank you for that one. So parents listening to the program at this time, I want us to learn from every particular segment we get to on the talk today. The children are more prone to burn injuries, so always ensure that you care for these children. Always ensure you're on the lookout for them so that they won't be involved with burn injuries. Now, there are treatments to burn injuries, and you have said it depends on the type of the cause that will matter on the kind of treatment. Can we, Mrs. Adeosun, take the causes one after the other, and maybe with a bit of explanation to each of them, so that we can know the different types of burn injuries? I'm talking about the causes now, before we even then talk about the treatment at all. What are the causes to burn injury?
causes of burn injuries are number one, fire
Fire.
or flames. We have blast from explosions, and then from hot water, from hot soup, from hot grease, also electrical, from electrical currents, and chemicals like strong acids, paint thinner, and gasoline.
Thank you, Ma. So let's look at how it can be treated. Now, you have said, Ma, that there are different ways to treat burn injury. Maybe we should do first aid conversation first, even before the treatment, because now I'm beginning to think in my head that whenever this burn injury happens, maybe as a parent, it happens to your child or somebody around you. Mrs. Adeoshi, what are some of the things we need to do first? What is the first attempt? You're in an environment and a burn injury just occurred, an accident just occurred, and somebody is battling with burn injury. What should be the first thing we should do at that time?
The first thing is to stop the cause of the burn. Let's say there is flame, there fire.
Yes.
You try to know the cause of the fire.
Of the fire outbreak.
And then you quench it. How do you do that? You can use wet blankets to cover the patient with fire. It will quench it.
Oh, really?
Yes. And also, if the patient, if the clothing catches fire,
yes,
tell the person not to run away. The person should lie down and roll on the ground.
The person that the fire is currently burning the clothes should lie
down and roll on the ground. By doing that, it will quench the fire.
So after doing that, making sure that you quench the fire, looking out for the source of that fire outbreak, what should we do next to that patient?
So after that,
yes, ma'am,
that you have quenched it, you remove the victims from the place. You now pour cool water.
Okay.
Cool water, lukewarm water from the tap. Not ice water this time around. It's not ice water, it's cool water. You continue to pour it on the patient for like 10 to 20 minutes.
Continuously?
Yes. So after doing that, you try to remove the clothing from the patient.
Okay.
If it doesn't get stuck, but if it gets stuck, you may leave it. You also remove any jewelries the patient is on.
Okay.
Because when burn occurs like that,
yes, there
are some mechanisms that will be going on, and the patient, you see most of them, they swell up. So because before the swelling, you try to remove the jewelries, the rings, the belts, and everything, because if they get swollen, to get those things removed might be, especially ring, might be very difficult. So you try to remove all those things.
Okay, yes, ma, you can go ahead, Mrs. Adeoshi.
After that,
yes, ma,
after you might have done that, you now look for clean clothes.
Clean clothes.
Clean and neat one. You cover the victim with it. Number two, keep the patient warm, because they lose a lot of water and they feel cold so much. So you need to keep them warm. After doing that,
yes,
you transfer them to the hospital.
They should go to the hospital?
Yes. They should seek medical attention immediately after that administration of first aid treatment. Take them to hospital. You don't apply anything.
Don't apply anything.
Don't apply honey, don't apply salt, don't
because
apply pap.
I was going to ask you, some people will tell you, oh, when you put salt around the person, some will tell you red oil. We hear a lot.
Engine oil, raw egg. No, you don't do that. Don't apply those things, because by applying those things, you are adding to their problem. It will cause discomfort, and it can cause infection for them. And raw egg, some people react to egg. You wouldn't know they are allergic issue. By the time you pour it on them, it will trigger the allergy. So that is the reason why it's not good to apply anything at home. Just take them to the hospital. When they reach hospital, the doctor will now assess and know what to do.
If you're listening, you're there at home and you want to be a part of this conversation, please feel free to call the studio lines. Mrs. Adeosho Folashade, Assistant Director, Nursing Services, General Hospital Ikorodu, will do well to attempt to all your questions while we talk about burn injuries. Now, the lessons that we should take home from this is that whenever these things happen, always take the patient down to the hospital, any hospital around you. Ensure you take them down there. Mrs. Adeosho, what do you have to say to self-medication, self-treatment? Because many a times, I want us to use this to get to the treatment. Many a times when these things happen, they just tell you, oh, there's a way they do it. Oh, hot water has put on it. Don't worry. This is how we always do it. What do you have to tell people that believes that self-treatment, self-medication is the way out when burn injury occurs?
Please, self-medication is not good. It will add to the problem. And many a times, it leads to complications of burn, because the burns that are supposed to heal normally, by the time they have added so many things on it, and by the time they delayed from bringing the patients to the hospital, complication might have occurred, especially infection. And in this our environment, you know that we have a lot of pollutions here and there. So that is the reason why it's not good to be doing self-medication when it comes to that, because it is an open wound. So we need to seek medical attention. We must not take that, we must not give them any treatment at home apart from the first aid treatment I had mentioned earlier on.
Sometimes when this burn injury occurs, Mrs. Adeosho, you would agree with me. You've seen a lot of these things. You've attended to many of these cases. When it occurs, one thing that happens a lot is we know that the patient is always in this discomfort and they always want to touch that particular spot where that burn injury has occurred. But we always hear that when there are burn injuries, you don't touch it. When you touch it, it gets worse. It peels off your skin. Can you enlighten us a little bit as regards how can patients deal with the pains? Looking at it's always painful, right? Looking at that moment, how can they deal with it? Many a times they want to touch, but we hear that if you touch, it's a problem. It spoils the skin. What can be done at that time?
Well, at that time, by the time patient is in the hospital, the kind of dressing we do for them, we call it occlusive dressing.
Okay.
We bandage them and we use dressing materials that absorbs well. So there is no room for them to be touching it. And then there are medications. By the time they give them those medications, they will feel comfortable a bit and feel relieved. So we know that burn injury is not something that is palatable. It is always very painful and it gives discomfort. But when they are in the hospital, all those areas had been taken care of.
Maybe we should attend to this first message here on WhatsApp, where this person is asking the message, what should happen or what should be done at minor burn injuries? This person wants to know, maybe because he said they should always come to the hospital. So this person is asking, is there no treatment we can just do personally ourselves? Do we have to come to the hospital all the time? This is from Sholaja from Igbobo.
Okay. If the burn injury is minor, and if it's maybe just a splash of hot things on the skin, if it does not affect fingers, if it does not affect the face, if it does not affect any joints, yes, you can treat it at home. But if it affects this area, don't say it is minor. So for those ones that don't affect these areas that I mentioned, what you do at home, you just try to pour water, cool water, as I've said.
Yes.
After that, you get mild soap, not antiseptic soap.
Aha.
Mild soap, maybe like Joy, like
And
Lux.
let's not promote those brands. They didn't pay us.
Sorry. You can use it to wash it. You rinse it
softly.
Softly. When you do that, there are some creams that they can use, apply lightly to the thing. So that is it.
So there's another message from here on our WhatsApp. This is coming from Brian from Erunwe. This person is talking about antibiotics. He says, what is the role of antibiotics with burn injuries? How effective is antibiotics to burn injuries?
Antibiotics is very important in the role of burn injury. We give it prophylactically, and then so it's good. There are many antibiotics that they do give, depending on the severity and the depth of the injury. So it plays important role on it. But all the same, we don't encourage self-medication.
Don't just go there and buy
any antibiotics and use it. Because all these antibiotics, they work differently. But by the time you come to the hospital, the doctor knows the one that will work for that particular injury, and it is that one that he or she will prescribe, not that we be doing trial and error.
The major reason why some people don't want to come to hospitals, the major reasons why some Nigerians think self-medication is the escape route, is because of the financial implication to it. So some people believe that, when it is burn injury, they will charge you money. Instead of go to the hospital, just go to a chemist and do all this self-medication. Let's talk about the treatment process. Can you give us, Mrs. Adeosun, can you give Nigerians a clear picture of how it looks like? This is the big question. That is the reason why you are here. So we can take all the time on this particular question. To treat burn injuries, what is the treatment like? The treatment process.
Well, health is wealth.
True.
The treatment depends on the severity of the bones, and then the extent, and the affected area, as I said. So the major thing is, wound dressing is there. When the major treatment is proper wound dressing.
Proper wound dressing by a professional.
By professionals under aseptic technique. Because we wouldn't want the wound to be infected. So that is the reason why the wound dressing must be done under aseptic technique. And also, as I had said, that we do occlusive dressing. We have special materials for that. That one will absorb discharges because they bring out fluids. They lose fluids a lot. So it will absorb it. It's not that it will be the one that will be wetting soiling their bed linens or so. We apply it very well that even if you see them, they will look neat. Although the expenses is there, but as I've said, that health is wealth. We need to take good care of ourselves. We won't say because of the cost implication that we will not give ourselves best medical care. No, we should do that. And apart from wound dressing, we do that one depending on the extent. Like twice in a week.
Twice in a week?
Yes, for occlusive one. Because the kind of dressing we do. So, and also the nutrition is very important because they lose a lot of fluids and nutrients. So they are always placed on high protein diet. High protein diet. Most especially eggs.
Eggs?
Yes, eggs have been so good. And as they are doing that, the medication is there. The analgesics to relieve pains.
Aha.
They give them a lot of pain relievers.
Mm.
They take it, antibiotics to prevent infection or to combat it if the patient has developed it.
Mrs. Adeosun, can we look at a possible long-term effect? Because this is another side. And like I said the other time, some persons just choose to ignore sometimes when these bone injuries occur. But what are some long-term effects that might occur to people who neglect or go for proper treatment when bone injury occurs? What are some very long-term effects that might happen?
The long-term effect is number one, there might be infection.
Infection.
Yes. And also, if the wound heals, it will form scar or keloid. Scar, that is it will leave, the mark will be there.
It will be there, and that's when they say this is a forever mark.
And in some cases, this scar will now be raised up. That is what it calls keloid.
Okay.
That one, the treatment of that one is another thing entirely. So that is why it's always good not to delay in coming to the hospital. Another thing is contraction may occur. Even if the wound heals, we have seen cases that they take the cases to maybe the chemist or nearby hospitals. The wound heals, but did not heal well. The patient has contraction, and that one will require surgical intervention.
Which is bad.
Which is bad and expensive. So
you somebody who is supposed to spend 20,000 naira, maybe to have gone through the process of a proper treatment.
We now be spending like 200, 300,000 naira to release the contraction.
Mrs. Adeosun, can we talk about people that the way you are saying these things now? I know some persons at home listening will just feel like, oh, okay, they say we should go to hospital, we will go. There are cases, where somebody will come to the hospital for treatment, and then afterwards maybe just go back to one Egbele nurse, like it is always said, that one should continue my treatment and my dressing and all that. I want us to talk about people who don't continue their treatment at a particular place. Mrs. Adeosun, let's talk about these people that have decided that, oh, we want to come to the hospital because we don't have the money, let's just go and do our first dressing. I don't know if there's something they call first dressing and they'll go and do continuous dressing somewhere else. Is this still fine, or it is something that is wrong? Maybe because that person who dressed it at first understands where he or she has stopped and might be the one to continue, or it doesn't matter, anybody can continue.
No, we don't do that. It's not good. It's not the best. Because in some places, in some all these chemists, they use a lot of wrong solutions. They apply it to the wound. So, and we don't want that. It will add to the patient's problem. So we don't encourage that at all. We don't encourage it.
So if you start from this place, ensure you finish your treatment
Yes, it's
there.
always good to do so. Because by the time the wound is healing, the patient may need to go for physiotherapy.
Okay.
That's another treatment in order to prevent contraction.
Yes.
But if the patient had gone and didn't come, so that means the patient will not know, and we too will not know when by the time the patient is having some problem. But when they are in the hospital and we know the area that is being affected, if it affects the fingers, the hands, the joints, we know that the patient should start exercise on time, whether passive or active one on time. So that is why we don't encourage them to go elsewhere.
When you start it from here, ensure you finish there. Thank you for that one, Mrs. Adeosun. Still talking about questions as regards bone injuries on the issues on IKD 106.1 FM. Let's talk about preventive measures. Like they say, prevention is better than cure. If there are people who are currently battling with one bone injury or the other, we really hope that you get better and you stay back on your feet again. But then for those that are not involved in bone injuries, how can we prevent it? What are the best ways to prevent bone injuries from occurring?
Prevention is better than cure.
Yes, ma'am.
So it's always good to prevent burns at home. Let me start from home. especially in the kitchen,
Mm.
because most burn injuries occur in the kitchen.
Most of them.
Most of them, especially with the kids.
Mm.
So at home in the kitchen, when you are cooking, our pot handle
Okay.
should not be placed at the edge of the stove. It should not be placed where people are working. It should be
When they cook,
away,
the easy body contact
very
with it.
easy contact to it. It should be placed far away from that place. And for our children, there should be like 3 foot kids zone area where the baby cannot reach in the kitchen.
Mm.
In fact, it's always advisable not to allow children in the kitchen, but at times you have some children that
have the flair.
yes, so the parents need to be very careful when you have that kind of children, and you try to keep the children away from hot liquids, hot foods, or anything that can cause burns for the patient. And for the adults too, when you want to carry your pots or whatever, use pot holders. Do something when you are carrying, so that you will not get your palm burns. When we are dealing with our microwaves too,
Yes.
we should try, to protect ourselves and use something to guide ourselves when we are in the kitchen. The kind of clothes we put on should be the one that is short, well fitted, not with long hand and big one that can catch fire unknowingly.
You should always wear fitted clothes in the kitchen.
Clothes, short sleeves,
not Iru and Buba.
not
Agbada.
Iru and Buba, not bubu, not big ones that can catch fire unknowingly that you will not know until it starts burning your body. So, and you should beware of hot surfaces.
Okay.
Anywhere that's hot surfaces, we should be aware of it. In the bedroom, if we have water heater at home,
Yes.
we should set the temperature to like 120 degree Fahrenheit. That is the normal just something for it. We should set it there. And also, if we don't have it, if we want to, we should test the water we want to use to bath ourselves or our baby. And how do we test that? We can use bath thermometer. If we don't have, we should use our elbow or our wrist. We dip it inside the water.
The elbow or the wrist?
Or the wrist. We dip it on the water we want to use to bath. So that's what we should do. And we should not allow our children inside the bathroom with water they want to use, the hot water, that warm water that is already there. Or maybe you are preparing water, you put hot water there, you now leave the child and the water in the bathroom, you go into the shade lobby or sitting room to bring another thing or what. No, we shouldn't do that. We should prepare everything needed to take to bath for the baby before taking them into the bathroom.
That's brilliant. Yes, you can go ahead, Mrs. Adeosun.
In the offices,
yes, ma'am,
we make sure all our appliances that we are not using should be unplugged. We should not plug it. When we are leaving our offices, all our appliances, we should switch them up. Even at home too, we should practice it. And if there is any switch, open switch that we don't use, we should not leave it open. Because anybody can put anything there. Even children, they can put anything there and it will catch fire. So we should try to avoid that. We should try to cover it.
Okay, thank you, Mrs. Adeosun. You are Mrs. Adeosun, which is a typical Yoruba name. For those of us who knows where that name comes from, that is a very big name in that state. For you, man, some people believe that when burn injury occurs, there are leaves, there are things we can just put together, join this one together, and take care of that burns. Why do we need to go to the hospital? For you, what do you have to say with traditional methods of treating burn injuries?
Well, I would like to discourage it. Because by the time you are putting all those things there, you are adding to the problem. You are passing infection to it. Because when a patient has burns and comes to the hospital, all the things that we use to cover them, to treat them, they are always sterile. By the time you just go and plug lips, maybe you dey squeeze it, you are putting the water whatever there, you are contaminating it. And some may even have corrosive agents in them that will now add to the will make the minor wound to become major. You know, it will deepen the wound. So that is the reason why I will not support it. I will not support it.
Thank you. You heard that from Mrs. Adeosun Folashade, Assistant Director, Nursing Services, General Hospital Ikorodu, saying a very big no to traditional way of treating burn injuries. Always ensure that you visit your medical practitioner. They would always be there to attend to you anytime, any day. We're gradually wrapping up this conversation. We're gradually getting there. Mrs. Adeosun, I want us to talk about the children. These are the major patients that get involved with burn injuries, which means if the children are having the higher numbers of people who battle burn injuries, then the school has a role to play. What do you think you can tell schools? What do you think your advice would be to schools as regard burn injuries and how to manage these children? I like the fact that you've talked about our workplaces. I like the fact that you've talked about our homes, especially the kitchen. Can we also talk about the schools too, where the children spend enough of their time?
I think at school too, they should be watchful. They should have close monitoring of these kids at school. Like some of them, they use some food flags that are very, very hot. The food there are very, very hot. So when they want to eat, they should try to supervise them. Maybe they dish the food from inside that food flask to somewhere to reduce the temperature before they eat it. Because by the time they dip their hand by mistake into it can give them minor burns.
True.
And at school too, all the switches and the electrical appliances, they should be well positioned away from the reach of the school children. Any switch they do not use should be well covered. Because these kids, they can go there and putting by something, they may put spoon,
which is metal.
If it is metal, you know, it will cause problem for them. So the school also has a role. And at school too, they should have
this fire extinguisher. Yes.
And then burns smoke alert.
Okay, smoke alert.
They should have smoke alert.
In schools?
In schools. Even at homes, we should. But in school, they should have. So that they will detect if there is any area that wants to burn or something there is contact.
They can easily detect.
They can easily disconnect and avert the hazard. They too, they need it. They need to have it there at school.
Ma, we have to let you go. We are aware that you still need to return back to work, and I thank to maybe some people that are currently dealing with burn injuries. We know you're at your workspace, and we thank you so much for your time this morning. But before you go, Ma, right? We have talked about schools, we have talked about our homes, we've talked about the kitchen, which is the major place. Can we also talk about the government? And with all sincerity, Mrs. Adeosun, let's stay here in Lagos. You're currently with General Hospital Ikorodu. Do you think the Lagos State government are doing well enough in attending to... now, this is where my question is coming from. There are some situations where we hear that, it's free. For instance, when you have tuberculosis, it's free treatment. I can't remember some others, but I know there are times where government just pay freely. Do you think the government, Lagos State government, are doing well enough when we look at your department where they attend to burn injuries? Do you think the government are doing well or they can do better?
Well, they are trying, and I believe they can still do better. Because at times when we have patients that are unable to procure the materials, we have a unit in my own hospital,
Okay.
social welfare unit.
Good.
By the time we go there, they get all those things for our patients. They do
Free
it.
of charge.
Free of charge.
Beautiful.
They do it.
Beautiful.
And even the workers, we do it. I do it.
Wow.
Many people do it. My doctor, everybody. We try to assist because we know that the cost implication is very high. And we want them to get better. So our own hospital is trying in that area. We have a unit for that. Anytime we have a patient with financial constraints, we go there and they solve the problem for us.
Let's talk about stigmatization, Mrs. Adeosun. You've done just so well this morning, and that might be the last question I'll be asking you before we go this morning. Sometimes when burn injury occurs, we have people who just want to step aside. Maybe, for instance, fire outbreak, car accident. You just see people step aside and say, no, I can't touch, I can't do it. You see that attitude and reaction from people. What do you have to say to people like this, and what would your advice be to people if they are opportune to be at spaces where somebody is currently battling with burn injury? But before you answer that, let's take this call. Hello to you, good morning. Mr. Biola, good morning, sir. Yes, your question.
My name is Biola. My question is the way our parents using water. You see, because of people, they go pour water in the morning, they bath. And some people say you don't bath. Water, they change it to tea. Then some people put the dispenser for bedroom and using it. Then it's good for body. Me, I like to use hot water to bath because the water has some doctors and not. That's why I'm talking.
All right.
Say, is it good or not?
All right. Thank you. Thank you, Mr. Adeosun. I said Mr. Adeosun. Thank you, Mr. Abiola. That one. So his question is this. He's saying that the way you're saying it, the hot water to bathe and all, for him, he does not like to use hot water because of the fear of burns and so that nothing will happen to his skin. So he is asking the question that, is it even good normally to use hot water to bathe? But I think that's a simple question. Maybe you should attend to that.
No, you can't use hot water to bath. It's lukewarm water, warm water.
Not hot water.
Not hot water. You don't use hot water to bath. You can't. It's warm water. That is the reason why we are saying that they should test it first before they pour it on their body.
Or even the children's body.
And children's body. It's lukewarm water, not ice water, not hot water. Not hot water.
Okay, so sir, Mr. Abiola, I hope you heard that. It's okay to use lukewarm water, warm water to bathe. I know somebody who she bathes with warm water every day. I hope that is also fine, I hope it's not more like an addiction, or maybe there are implications to that for somebody who decides that every day of my life I want to bathe with lukewarm water. Is that okay?
There is no problem.
No problem with that.
Yes,
Beautiful.
Yes.
Beautiful. So,
no
going back to the previous question, looking at people's response, part of our topic talks about response, how we attend to these people. Sometimes an accident occurs, somebody is battling with burn, you see everybody just step back. Sometimes you even see people come out with their phones to do videos. Nobody wants to go close. How can you encourage people? What would be that motivating statement you give to Nigerians that when these things happen, rather than stay back, you can help?
When this happens, if at all you cannot assist, you can call for help. Call for help, and the emergency lines are open, and they are free.
Yes,
so
free.
You can call the emergency number.
Yes, you can. Yes. You can mention that. That is, since they are toll free lines.
Yes, you can call 119 if you happen to be in that situation, maybe because of fear. So just try to call for help and send a text or call this number They will not charge you for it.
Mm.
They will pick it.
These are
and they will
toll-free
respond.
lines.
Yes. We have emergency lines and emergency mobile hospitals. They will come immediately.
So for those of you at home, whenever these things occur, please do well to save a life. Burn injuries could escalate and become even worse if not properly attended to as early as possible. And of course, the emergency lines is 119. I hope I'm correct. Is it 119 or 199? 119.
It's 119.
119, yes. 119. You can always call 119. It's totally free. It comes with no payment at all. That is why it's called toll-free line. Mrs. Adeosun, we have to let you go back to work and want to say thank you so very much. In your voice, in your words, what will be your parting words to everybody, Lagosians, people of Ikorodu? Okay, maybe there's a question for you. Hello to you.
Good morning.
Mr. Friday, please reduce the volume of your radio set so we can hear you.
I'm doing that, sir.
All right, thank you.
Good morning, sir.
Good morning, Mr. Friday.
Good morning to the woman of.
Good morning, sir.
Yeah, we appreciate your lecture this morning.
Okay.
I've missed some of your words. So I don't know, maybe you've talked about it before. You know, when one has a probably maybe hot water burn, you know, sometimes they always put something like, oyin, what they call oyin now?
Honey.
Honey.
I hope I'm correct. Honey, yes, honey.
Yeah, and this thing as well, probably maybe egg. Sometimes they will break an egg and pour it there. So is it good if one is doing that? So that's the question also.
Thank you, Mr. Friday. Maybe you please attend to it.
Thank you, sir. Although I've mentioned it.
Exactly.
It's not good, sir. It's not good. Don't add it. Don't pour it. I've said so that you are adding to the problem by the time you pour them on it. Like egg, you don't know the allergic status of the patient. And because some people react to egg, by the time you pour it there and allergic reaction is being stimulated, that's another problem that can even claim the patient's life.
It could be that bad?
Yes, it could be bad.
Wow.
Also, it can cause infection. The honey too, it can cause infection. Don't apply salt. Don't apply any engine oil.
Red oil.
Red oil. You know, they are all based. They will deepen the wound and increase the heat. So by doing that, they will add to the comfort of the patient. They will cause discomfort for the patient. So it's not good to pour all these things on it. It is only lukewarm water, running water, that you should pour on it. Don't pour anything. Thank you, sir.
Thank you very much, Mrs. Adeosun. This is how far we can have it today on the issues. But before you go, ma, please, your parting words to Nigerians, Lagosians, and the good people of Ikorodu.
Great Nigerians, great Lagosians, I want to appreciate you for listening and for paying attention to my talk today. And I hope that we have gained one thing or the other. I want us to put it into practice and help us to pass the information to as many people that don't have the opportunity to listen to it. I wish all of us well. We will all enjoy good health in the name of Jesus.
Thank you very much, Mrs. Adeosun Folashade Bukayo, Assistant Director, Nursing Services General Hospital Ikorodu. You have joined us in the studio this morning to talk about burn injuries, proper response and treatment. Now, for those of you listening, please do well to ensure that you take care of yourselves. Prevention, they say, is better than cure. Try as much as possible to prevent any measures that might lead to burn injuries. And if you're battling with burn injuries, please do well to ensure that you get proper treatment. And how best can you do that? Visit any hospital around you. General Hospital would always be available to attend to you. I am Opayemi Adebambo. Until next week, Thursday, same time, same station. God bless Nigeria. God bless Lagos. God bless Ikorodu.